Women's health is crucial to the well-being of not just women, but also their families. Thanks for joining us on 25 News Midday. It is Wednesday, March 19th, and we're taking the time to dive into women's health. Seeing an OBGYN is an essential part of every woman's healthcare routine. By prioritizing women's health and maintaining an open relationship with a trusted OBGYN, we're ensuring that women can lead vibrant, fulfilling lives for years to come. Larissa Savage, a nurse practitioner and midwife with Carle Health, is here to discuss how visits to an OBGYN differ from seeing a general practitioner and tackle some common misconceptions surrounding women's reproductive health. Welcome, Larissa.
Thank you.
I'm so glad to have you here.
Yes, I'm so happy to be here.
So let's dive into it, because there are often people, well, they say women are more likely to go to the doctor than men, but why is it so important to not just go to a general doctor, but specifically a OBGYN?
Sure. So at an OB-GYN office, which stands for obstetrics and gynecology, part of what we specialize in is literally women's health. So this is when patients may have concerns about their period, or if they have pain with intercourse, or if they need to get a pap smear. So what OB-GYN is that we are specialized in things that deal with the uterus and the breasts, right? So we really specialize, and that's kind of our bread and butter. So a general practitioner is wonderful, but sometimes when it kind of goes beyond their specialty, that's when we come into play.
Absolutely. And how important is it to make sure that you're scheduling these appointments regularly, and how often should you be scheduling them?
Yes. So at a minimum, I would say annually. We really want to get you into our office. We want to do those routine screenings, because part of the benefit of being seen annually is that we're able to kind of keep things at bay. By doing those screenings, we prevent the risks of things like cervical cancer, breast cancer. Say we have an untreated sexually transmitted infection, or even just a regular vaginal infection. Those things can lead to other complications, and if we can see you yearly, we can treat those appropriately.
Absolutely. Now, I'm assuming our audience, most of them are at the age where they have visited. For those who have not, it's going to be an experience, your first time. But for those who have not, how do you prepare them for that experience?
Sure.
That's unique.
It is. So I like to tell my patients, because sometimes I am the first visit, especially for our younger patients, where they've never had a pap smear before, they've never completely undressed per se since they were a young child. And so I always tell patients, we're going to talk first. I want to hear about your history. I want to make you feel as comfortable as I can. I want to let you get to know me, why I'm passionate about this, why I care about your health. And then I really like them to know that we're going to gear their annual visit, their screenings, based on their lifestyle, their risk factors, because that first kind of questionnaire, the history taking, is really critical for what we do. And then I like to even pull up the instruments we use. What is a speculum? What does it look like? Why do we put the gel on it? How do we try to make them as comfortable as possible with a very invasive exam? So I think giving those visuals and making sure, I always tell them, you're in control. You're in charge of the exam. So you can always ask me to stop, and we can always take a break.
Yeah, nice, nice. It's glad that you guide them through that, because like I said, it's a very unique experience.
Yes.
And speaking of services and the things that you do with your patients, Carle Health opened a new clinic.
We
did. So tell us about that clinic and the services there.
So in August of this last year, we opened up our brand new clinic, our office over near the Proctor Hospital, so in that professional building. What's really unique about our office is that we have multiple specialties within our one office. So I specialize in basically pregnancy, so prenatal, postnatal care. I can do other things, but that's kind of my bread and butter. We have a nurse practitioner that specializes in menopause, which is a huge part of a woman's life in general. It's kind of half of our life, if you want to look at it that way. And then we have a MD who does minimally invasive surgery, which is kind of a fancy term for saying surgery where we can optimize people who might be having issues with prolapse or incontinence. And then we also, what's very unique about us being associated with Carle is that we work with the laborist team. So we actually are associated with the in-house OB-GYN on labor and delivery over at Methodist Hospital. And so we have a very unique connection to Dr. Lowe is one of our physicians who does a lot of our deliveries over at the hospital.
That is amazing. A lot of
Yes.
services that women should be utilizing,
Yes.
right? So, the question I wanted to ask you next, unfortunately, it is slowly slipping my mind, but in regards to the services that you guys offer, what are some
Fine.
common misconceptions that you hear from patients that make
Yes.
it into your office?
So women's health is huge. And so the misconceptions, because of social media, because of friends, family, you hear a lot. And so sometimes when patients come in for visits, we're able to say, I don't know where you heard that, but actually, here's the information we want you to know. And I think ultimately what we're looking forward to about having this segment and talking more about women's health is being able to maybe dive into more of those misconceptions, because there are a lot. So a couple that quickly come to my head are, often patients might think that they might have had a pap smear done at like a prompt care or an ED. They don't do pap smears at those locations. I think people think a pelvic exam typically includes a pap smear, and it's not. I also hear patients are told that menopause is something you get through. It's not something we treat. We do have treatment options. We have ways that we can help you with those different symptoms. I sometimes hear that patients are told that different birth control can make them infertile. That's also not, I know, so then people are worried about birth control, and so then they opt to not take it. And I think just breaking some of those apart, I also hear, because I'm a midwife, people are surprised that I can take care of them when they're not pregnant. And I always remind them that I actually can take care of them from when they're a teenager all the way to when they're done with children and they're menopausal.
Wow.
So a midwife is not just pregnancy and delivery. It's our favorite, I would say, but we are able to do a lot of other things. So I think just welcoming people in and making a safe environment where they feel like they can ask those questions, where they say, this might be a stupid question, but it never is.
Yeah.
It never is.
That is so true. I mean, this is why we need to have these conversations, because Google will send you in a spiral and have you panicking and coming into your office asking all of these absurd questions. So thank you so much for coming in and sharing, and I look forward to our next conversation.
Yes, can't wait to come back.